Alright, so this is another one of the exercises that I tend to use with knee rehabilitation. So it's nice and easy as well, and it's nice and easy to progress. So it's like a staged hamstring glute bridge progression. So one of the things that we obviously try and get athletes to do is do a really good functional hip extension motion with bent knee. So that's one of the first things everyone, most protocols stick to. Then we move to that one leg stance, so obviously increasing stability and strength, especially through that single leg. So what we want to do here is do a bridge at just inside 90 degrees. And we're just going to push up. So full hip extension, come back down. Then he's going to lift this leg. So what I cue is either with stronger athletes, especially stronger core, try and cue this leg to sit right up over above. So what I use that is I use it as a weight essentially to drive straight down through the hip. And if the athlete can't do that because they've got tight hamstrings, I get them to bend at about 90 degrees. Make sure that knee stays inside the hip joint because it directly weights down, so it adds a little bit of resistance. If they find that really easy as well, you can get them to hug the leg, which helps with athletes that are prone to anterior pelvic tilting. So it actually neutralises pelvis, therefore, or pelvic angle or pelvic rotation. It makes it very, very hard to get into any anterior tilting, so it helps activate glutes more. So what we try and do here is step from here, and we try and step out. So we lift the toes off the ground, step out to 90 degrees, get the athlete the same thing, hug the knee, lift up, back down, looking for changes in hip extension. So you can see we're trying to get full hip extension every single time, not be shy of that. If they can't get full hip extension, you keep them at this particular point until they can. Then we're stepping out another sort of 10 to 15 degrees and pushing up again and then back down. Obviously, as you push out more, the hamstring takes over the movement a lot more, so it's much harder, but that's essentially what we want, and we want to load that hamstring as early as we can in the rehab process. Then you're going right out to what we call that end range knee extension here, because this is around about how you land when you're running, and that's how we're explaining it to an athlete. So we're justifying why we're going to make them do something maybe a bit harder by saying this is where you land and we need better hamstring control. So then we get them to go up and then back down. So you can see there that this is pretty tough for Harry here. So this is something that we'd get him to do as a progression, because that's where he is at right now in terms of his ability to do this bridge progression. It's a really good bridge progression. Find it's really useful, especially pre-surgery with athletes prior to knee, but it doesn't really matter whether you've got a knee injury or not. That's something that we look at right from scratch with a lot of our athletes.